Hello, this is Dr. Morris. I'm doing a review for the Exam 3 material for AP2. The material will cover the cardiac system and the pulmonary system, or the respiratory system. And I'm going to go over some information that will be a part of the lecture exam first, and then I'll go over some material that will be a portion of the lab exam. Let's start off with the respiratory system. Remember, the respiratory system, I believe that's chapter 23. I know one chapter is 21, it's 23. I believe the respiratory system is chapter 23. Remember, the respiratory system begins as we inhale air in, so that's going to begin in the upper respiratory portion. So the nasal cavity is important. You should understand the structure of the nasal cavity and the role of the nasal cavity. You should be familiar with some of the central control systems, in other words, the centers in the nervous system, in the central nervous system. The pneumotaxic, if I can say it, the pneumotaxic centers, which are located in the pons, which is a portion of the brainstem. You should be familiar with the role of that center. And it has several different functions and roles, and so be very familiar. There's several questions about the pneumotaxic center. Also, you should be able to follow the path of air. As a person takes in a breath of air, obviously goes through the upper respiratory system. You should know the passageways in the upper respiratory system as it leads into the oral airway, and then through the trachea, then into the mainstem bronchi, the bronchioles, and this far down into the alveolar. So you should be able to follow that movement of air. You should understand the principle between pressures, the pressure of the atmosphere and the pressure inside and outside the lungs, and why that's important in the respiratory system. You should be familiar with, again, the conduction system of air, namely the trachea, the bronchus, bronchioles. Upper respiratory system, oral airway. We already talked about the nasal cavity, the larynx, the laryngopharynx area. You should be familiar with the gas exchange sites in the lungs. Remember, the actual site of exchange is at the level of the alveoli. And you should understand the principles behind how a gas exchange occurs there. The structure of the membrane at the level of the alveoli, the pressure differences between carbon dioxide and oxygen. You should be familiar with irritants and how irritants can affect the respiratory system, particularly in the rate of mucus production. What causes this production of mucus to occur? Typically, it's going to be the exposure to something that's irritating to the respiratory system. You should be able to give me a good description of the anatomical features of the lungs, both the right and left lungs, and remember there are some anatomical differences between those two surfaces of the lungs. Should obviously know what's meant by the apex and the base of the lung, the cardiac notch, for example, the fissures, the major fissures of the lungs. You should be familiar with the procedure tracheostomy, why that's an important procedure. You should know the respiratory membranes of the lungs. We've talked about in the area of the alveoli where gas exchange takes place. There's a specific type of cell type that's located there for gas exchange. The epithelial tissue changes as you move further up the lung, and you should be familiar with that. You should be able to give me the primary differences between the right and the left lung. There are specific types of cells called type 2 pneumocytes of the lungs. They have a specific role. You should be able to give me the specific role in that. Should also be able to tell me the role of surfactant and why surfactant is important. You should be able to describe the disease condition emphysema and what that disease can do to the lung and lung tissue. There is also an infection called tuberculosis, Mycobacterium tuberculosis, and it causes a specific change in disease pattern in the lungs, and destruction of lung tissue. Should be able to describe that pattern to me as well. There are various types of cartilages that are involved in the respiratory system, and your book does a good job of explaining those. You should be able to identify and describe the cricoid cartilage, the thyroid cartilage, the epiglottis, the caniculate cartilage. You should also be able to give me the partial pressure of carbon dioxide, why that's important, the partial pressure of oxygen, and why that's important. You should be able to give me a basic understanding of Dalton's law and why that's important in the respiratory system. There's also another substance that's involved in the respiratory system referred to as carbonic anhydrase. You need to be able to explain to me why that substance is important. You need to be able to describe to me the mechanism of quiet breathing, and how this occurs. You should also be able to explain to me how the glottis and at the same time increased tension in the vocal cord can change the pitch and the volume of a person's voice. You should be able to describe to me the following organs: the larynx, the oropharynx, the bronchi, the trachea, alveoli. You should be able to give me the primary function of the nasal mucosis. You should also be able to describe to me the different shapes of the tracheal cartilages and why that is important. You should be able to explain to me the disease process, asthma. You should be able to follow a breath of air from the external environment into the upper respiratory tract, coming through the nose and the oropharynx, and passing it all the way to the point of diffusion between the point of the alveoli and the capillaries. You should be able to do that in order. You should be able to describe to me or give me the definition of phonation. You should be able to identify the soft palate and the hard palate. You should be able to tell me where would you find pseudostratified ciliated columnar epithelial tissue in the respiratory system. Moving on to the cardiac system, you should be able to give me the effect of epinephrine on the cardiac system and what receptors would it involve. You should be able to tell me how a drug that blocks beta-1 adrenergic receptors would affect the heart. You should be able to describe the major vessels that enter and leave the heart, for example, the superior inferior vena cava and the aorta. You should be able to describe each chamber of the heart, the right, left side of the heart, the right and left side of the heart, both have chambers, should be able to describe those. Remember now that even though there's a change in the size of those chambers, and when I say size, I don't mean the actual volume of the chambers. Remember, each of the chambers of the heart hold the same amount of volume. However, the size of the chambers, the muscular size of the chambers are different. But the actual volume of blood that each of the chambers of the heart receives and delivers is the same from chamber to chamber. You should be able to follow the flow of blood that enters the heart through the right atrium of the heart, and you should be able to follow that to the left atrium, from the right atrium to the right ventricle, through the pulmonary arteries, into the lungs, back out of the lungs, through the pulmonary veins, into the left atrium of the heart, the left ventricle of the heart, and out of the heart, in order. You should be able to describe each of the heart valves that are involved in the heart. There are heart valves between the right and left ventricle, between the right atrium and the right ventricle, between the left atrium and the left ventricle, between the major vessels. There are heart valves. You should be able to give me a clear description of those heart valves, and you will be asked questions. You should know what the papillary muscles are. You should know what the chordae tendineae are, the trabecular carne, the moderator band. All of those are structures that you should be able to identify and be able to describe. Should be able to know the physical differences between the right ventricle and the left ventricle. Should be able to know the differences between the pulmonary veins and the pulmonary arteries. Where do they take blood to and from? You should be able to identify the coronary arteries. You should be able to understand the principle of heart murmurs. What valves can cause heart murmurs? What types of disease processes can cause murmurs? You should be able to give me a general idea of the size of the heart. You should be able to give me the effect of the vagus nerve on the heart. And if there is no vagus innervation of the heart, what will occur in the heart? You should be able to give me a good idea about the functioning of the bicuspid or the mitral valve. Where is it located at? How does it control circulation? What would occur if there was damage to the mitral valve? You should be able to give me a description of the disease entity mitral valve prolapse. You should be able to give me the role and function, I may have asked this already, between the pulmonary arteries and the pulmonary veins. You should be able to tell me the difference between the foramen ovale and the fossa ovalis. The foramen ovale and the fossa ovalis. Should be able to give me what is meant by cardiac output and what controls or affects cardiac output. In the electrical conduction of the heart, you should be able to tell me what is signified by P wave, QRS, and T wave. What do they represent? You should be able to describe the electrical conduction pattern in the heart, beginning with the SA node, going to the AV node, through the bundle branches, the Purkinje fibers, should be able to follow that electrical impulse in the conduction system of the heart. You should be able to tell me what is meant by Starling's law of the heart and why that's important in the volume aspect of the heart. Again, Starling's law. You should be able to describe to me the disease entity cardiac tamponade. That covers the material that we'll see on the lecture portion of the exam. Going to share the desktop here with you now, and just to go over some items that you should be able to identify as a part of the laboratory portion. And it's pretty straightforward and complements what we've talked about before with the lecture portion. This is an example of the pericardial sac. As you can see, the pericardial sac, this is where fluid can accumulate. There's a condition called pericardial tamponade, and I use this normal illustration here. If this sac fills up with too much fluid, that fluid creates weight around the heart, and then will certainly constrict the pumping action of the heart as well. So this is the pericardial cavity. As you can see, a male fist, it represents about the size of a heart, and that's why it's used in this example. Again, this presentation actually comes off of the of your course documents. Should be able to look at the histology of the cardiac tissue. Remember, it's branching tissue, centrally located nuclei, and it has striations in it that are give it a typical pattern for cardiac muscle. And you should be able to recognize that pattern. It's shown histologically on the exam. This is the photograph that you commonly would see. Remember, it has intercalated disc as well that help to differentiate it from other skeletal muscle. Now, this picture you've become very familiar with because there are items that you have to identify here. Great vessels, obviously. The different heart valves that you can see located here. The fossa ovale, the trabeculae carneae, the moderator band, the papillary muscle, the chordae tendineae. It's all structures that I would expect you to be able to identify. Notice the difference between the left ventricle and the right ventricle. Notice the thickness of the muscle here of the left ventricle. This is the same representation, just a gross anatomical view here. Same structures, same things I could ask you to identify. Obviously, I'd have to point specifically to some areas here if I asked you to identify, for example, chordae tendineae. If I asked you to identify the intraventricular septum. Again, that's the same picture that I showed you before. And it basically, most of the questions, I believe, for your lab portion of the exam come from that illustration. Another view of some heart valves. think that pretty much covers all the information or these areas that I asked you to identify for the purposes of the lab exam for the cardiac system. For the respiratory system, should be familiar with the anatomical structures of the upper airway. There are a significant number of cartilaginous structures. We'll start with the epiglottis. I would expect you to identify that. The vocal folds or the vocal cords, the area of the glottis, the cuneiform cartilages and the corniculate cartilages, I would expect you to be able to identify. You should also be able to identify an open glottis versus a closed glottis. I'm sorry, I meant to point that out. Anatomically, the trachea, it branches into the left and right mainstem bronchus. Notice that the right mainstem bronchus is a little less angulated, and it's also a wider, broader, and shorter bronchus than we see the left. So when people aspirate, most substances fall over into the right side of the lung. Aspiration, a foreign object is actually swallowed into the lung, or secretions, infected secretions. If they're going to go anywhere, they typically will go to the right side of the lung. So we see a lot more pathology on the right side of the lung than we do on the left. Notice how the tracheal rings are shaped. C-shaped rings, soft tissue in the back, because the esophagus in the back, so that way when you swallow large substances, it does not get caught up on the cartilaginous ring. So it's soft, just a C-shaped ring. So we feel that anteriorly. There's no cartilage noted posteriorly. Should be able to tell me the differences between the two different lobes of the lungs. Superior, middle, inferior lobe. You see on the left side that there's only a superior and inferior lobe. There's also a cardiac notch as well. The major fissures, the oblique fissure on the left, you have both an oblique and a middle fissure on the right. The hilus of the lung, where the major blood vessels and bronchus go into the lung. The differences in the structure and how the airway actually tapers down as you go deeper into the lung, the mainstem bronchus, the bronchioles, and as you can see, cartilaginous structures change, the diameter changes, and then you get to the alveoli where you actually have the gaseous exchange taking place. Some respiratory mechanisms of the lungs. Remember the interior and external intercostal muscles, primarily the internal intercostal muscles are responsible for aspects of respiration. The largest muscle responsible for respiration is the diaphragm. Should know that and be familiar with the major contribution of the diaphragm to the respiratory effort. We talked about the higher system, the pneumotactic system located in the pons, which is at the brainstem, and how it's important. You should be familiar with the relationship, very important, the relationship between the pneumotactic system and the amnestic center in the brain. And that concludes the material that will be covered on the lecture and the lab portion of your exam. Remember to do your assignments on Course Compass, because that will help you in your study, and good luck on the exam.